and welcome to today's edition of BOOBSBY, your favorite plastic surgery show. Please, if you have not done yet, please subscribe to this channel and of course follow me on Instagram. Why subscribing to channel today? Because after this show I will draw a person out of all subscribers who will get a free treatment of Botox or filler. So today we're talking about recovery and pain after breast augmentation surgery. After this terrible video yesterday, not so terrible, but okay, we all need a little bit of recovery. So let's go through what you can expect after surgery, what you should do, you can do, and how we can help you during the recovery period. You will wake up after surgery with, of course, all the effects of anesthesia. So dizzy, sleepy, and of course with some pain. Usually immediately after surgery the pain is not really bad because there is still effect of anesthesia which really calms the pain down. But in the first few hours after surgery the pain starts to develop. We of course use painkillers in the IV solution directly into the vein to diminish the pain, but some pain is still there. The pain after breast surgery is usually dull type of pain. Dull meaning patients describe it as an elephant sitting on the chest. So with every breath intake it gets worse, with exhale it gets a little bit better. So the trick is to breathe without moving the chest too much. Try breathing through the stomach. That helps a lot to prevent pain. But of course, some painkiller is always needed. Yesterday, I showed you the local anesthetic that we used during surgery. The effect is the effect of local anesthetic, of course, is there, but it's not 100%, of course, and it's really individual. There are girls with a lot of pain, and there are others with minimal pain. So what you can expect, I mean, it's really personal. Some girls who have really high tolerance to pain have a lot of pain, and some who have low tolerance of pain have no pain. So there is really no rule what to expect. The bra, of course, we install immediately after surgery, and sometimes you use extra bandage for some extra compression for safety. A patient goes home usually about 6 hours after surgery if everything is fine. Sometimes they stay in the clinic overnight, but it's quite rare nowadays. We give them good instructions. We give them painkillers, antibiotics, everything they need when they go home. We have instructions like this also written, so it's everything what can be expected, what to do, and our contacts, of course, and everything. And of course, we always call our patients the day after surgery and in the next days to check everything is fine. So what to expect in the first 7 days when you are at home? Of course, we suggest a lot of rest. It doesn't mean that you have to stay in bed. You can go out, you can walk, you can do some minimal activities, you can brush your teeth, you can go to the toilet, you can even prepare some meal. That is usually not a problem. Maybe on the first and second day, because the effect of anesthesia is still there, so there is still some tiredness, some sleepiness, but in the next day this goes away and the person starts feeling better and better. Of course, expect pain, the dull pain I said before, and in the first week we always suggest taking painkillers on a regular basis as instructed. Next to painkillers, of course, is antibiotics. We also always give a course of antibiotics for the first 5 days to prevent any infection developing. We also suggest using ice packs, the blue square ice packs to put on the breast to diminish the swelling and also to control pain. Never use ice packs directly on your skin because you will burn the skin or freeze the skin. Always use it over some textile, some cloth or whatever, or maybe a towel. So it's not in direct contact with skin. We have seen bad wounds because of the skin freezing under the ice packs. During the first week, the bra should not be removed. It should stay put, stay there, and you should be on 24/7. And of course, we suggest light food and plenty of drink. During the first week is also a good time to start lymphatic drainage. It's a special type of massage that helps evacuate the swelling. It helps to control pain and really makes the area feel much better, less pain, more comfortable. During the first week, you know, the shape of the breast is commonly very strange, square or too high, or I don't know. Sometimes, of course, also a little bit blue here under the breast, here in the medial part. Sometimes there's a lot of swelling that the cleavage is almost gone, that it's almost flat between the area between the two breasts. So everything is possible during the first week. Don't worry, all these phenomena are completely normal and they go away in the next few weeks. After the first week, we usually do the first control visit, so we check the situation. We open the bra, check the breast, see how the swelling is, control some hematomas that might be developing or have developed. We usually do not check the wounds. We leave it covered. And then after this control visit with us, of course, there are some more things that you can start doing. You can get more and more active during the course of these next weeks. But still, you know, everything should be done with care. Not too much, no lifting of heavy things, no pulling, pushing, no sports. Of course, there can be still some pain, and we suggest painkillers if needed, usually in the evening. The bra can be taken off every day for about an hour, even 2 hours, to of course wash the bra and to take a shower. After the first week, the showering is allowed, so you can shower with normal water, use a little bit of soap, not too much. The wounds will be fine. If there is some small patch, some small bandage on the wound, don't worry, it will not go away. After the shower, after washing the bra, you can of course put it back on. The shape can be still quite strange, especially if the breast augmentation was done together with breast lift. The breast can look too high up here at the chin. Do not worry, that is very normal, and they will drop as the weeks pass. After breast augmentation, the swelling can be in the upper part, and it looks like two sausages or two bananas in this area, and it makes the breast look quite square, which is extremely strange to see. But again, do not worry, the banana-shaped swelling in the upper part is the swelling of pectoral muscle, and this will also go away in the next weeks. Some asymmetry, sometimes one breast is bigger than the other, is higher than the other, also very normal. Also, the pain can be much more pronounced on one side than the other. So, some asymmetries in shape, pain, feel, swelling, completely normal during this period. Nothing to do, nothing to worry about. Now, the very common question: what can I do during this first month? So when can I start with my work? Well, we suggest starting with office work, doing work on computer, so light work after 1 week. Then starting work of maybe beautician or hairdresser, so let's say light manual work after 2 weeks. Starting heavier work, maybe in a factory or something, after 3 to 4 weeks. Sex, it depends, of course, on the activity, but you can go slowly, maybe after the first week, and then get more active in the next weeks. So after 1 month, what you can do? After 1 month, you can remove the bra, and you can throw it away because you will you will really get tired of this bra, and start wearing normal bras. In this period of time, we also do the second control visit to see everything is fine. Usually, we remove the remaining bandages and check the stitches. Normally, all the stitches are resorbable, which means that they do not have to be removed. If there is any stitches sticking out, we removed it during this visit. And we also give instructions how to care for the scar, how to wear or what kind of bras to wear, and give instructions how to check the breast if everything is fine, how to palpate it, how to see, everything is normal. About sports activity, after the first month, light sport activity can be started, especially in the lower part of the body. Some girls start even before, even after 2 or 3 weeks, they start doing exercise for legs and buttocks. That's completely fine if you feel comfortable doing it. To start workout of the upper part, so of the arms, shoulders, and chest area, we suggest waiting about 2 months. At that time, the wounds inside, the muscle, and everything has healed, and the activities can be started. So this is how the recovery goes. I have some very common questions that you ask about recovery, and I will go through them because these are the answers I answer on a weekly basis after surgeries that we do. So the first question is, I am like 3 weeks after surgery. My breast is asymmetrical, one is higher than the other. I told you before, after 3 weeks, this is quite normal. After 3 months, not so much. Because after the first month, the final shape is going to start taking place, and the final shape, the breast settles maybe about 3 to 6 months after surgery. It's not the final result. There is never actually final result because the breast ages, of course, and it will change shape through the life. But let's say after 3 to 6 months, the result is what will remain in the future. So the next very common question is, I am again 2, 3, 4 weeks after surgery. I can feel some movement inside my left breast, some liquid or some air, again completely normal. When we do surgery, of course, when we insert the implant, some air comes inside the pocket, and so when we close the wound, when it stitches, of course the air is left inside. This air gets absorbed, and it's not a problem. Some liquid, of course, also when we close the wound, some blood might stay inside, and this blood will get absorbed during these first weeks. After the first month, usually we do not get questions like this anymore, so it usually settles. So no more air or liquid after the first month. Back pain. Oh yeah, very common. What can I do to prevent back pain? Of course, we suggest sleeping on the back to prevent any deformations of the breast after surgery. Sometimes this can be quite annoying because, of course, sleeping on the back makes your back hurt, and also it's quite difficult to sleep for some people on the back. I allow my patients to start sleeping on the side after 2 or 3 weeks if everything is fine. Usually I suggest them to use some pillow or something, to hug it, and so they get some support to the breast by doing that. So the back pain, goes away this way. Sport activities, I told you before, let me tell you again. So the sport activities are allowed for the lower part of the body about 3 weeks after surgery, upper part about 6 to 8 weeks after surgery. Sensibility, in the first period of, let's say, 1 month, 2 months, 3 months, there can be some changes of sensibility of the skin, even the nipple. Sometimes the skin is completely non-sensitive, so if you touch it, you don't feel anything. Some areas might be oversensitive, so if you touch it, you can feel pain or burning or tingling or all sorts of different sensations. Again, in the first months, this is completely normal. The nerves were, of course, stretched during surgery, and as long as they do not heal well, these feelings are normal. And when they will heal, the normal feeling will get back. Usually, there are some small defects of feel even months after, but usually not a problem. Sometimes the feeling in the nipples is bigger than before, sometimes it's smaller than before, but usually that is not a really big problem when everything settles. Again, I feel waves in the lower part. Yeah, girls ask me that in the lower part here, they can feel some waves, or especially here in the side area. Wrinkles are, I mean, it's called officially wrinkling or rippling. It's the implant that you can feel through the skin. The skin in the lateral part here is very thin, and here the implant is not covered by the muscle. So, I mean, there is implant and there's muscle immediately above it. And of course, since the skin is quite thin, the implant can be felt through the skin. It's more obvious when a girl is leaning forward like this. Then these waves can also become visible. It's quite normal. It happens with almost everybody, and it's nothing to do or worry about. It's there and it will stay there. Implants move with muscle contraction. Some women might notice that when they're doing some physical exercise, like lifting something heavy or doing workout, when they move the pectoral muscle, the chest muscle, it moves the implant. Yeah, it happens sometimes. Of course, the implant is placed under the muscle, so when the muscle pulls, it can move a little bit the implant. With most of the patients, it's not very visible. With some patients, it's quite a lot. It's quite bad, and sometimes it's a situation where we need to do a small correction to remove this deformation. One more thing about emergencies that might happen during the recovery period. Surgically, the most important emergency is if you notice that one side is getting much bigger than the other. Usually that means there is a hematoma, a blood collection. Why it happens? The pocket around the implant, of course, there were a lot of small blood vessels before surgery. We coagulated them, as I showed you yesterday, but sometimes after maybe some sort of movement or pulling or maybe small injury or a small, different reasons, or by itself, these small vessels can open. And when they open, the blood starts to enter the pocket around the implant, and it makes the breast bigger. It grows like maybe sometimes double the size in one night. That is quite an emergency. In those situations, we always ask the patients to call. So we take them back into the operating room. We open the wound. We remove the blood. We stop the bleeding. We reinsert the implant and close the wound. It's an annoyance. It's not something that would change the result, but it needs one short operating procedure to fix the situation. Long-term pain also happens. Some patients have problems with pain even years after surgery. Usually it's not a regular pain, but it's a sort of pulling pain or some tingling pain, or in some positions they might feel pain. Again, this is something that is quite common. It's again nothing to do about. It's something to accept and live with it. Okay, that is all about recovery pain after breast augmentation. Tomorrow and during the weekend, I will take some time off to make a plan for next week. Next week, we will start on Monday with questions about different questions about breast augmentation, breast lift, and all sorts of other, and everything connected to these procedures. Do not forget to subscribe to this channel on this side, so you enter the possibility to get a nice giveaway. And yeah, enjoy the weekend and see you on Monday. Thank you. Bye bye.